The Youngevity UK and Europe Show with Dr. Wallach.
Hi, my name's Jonathan Smith. Welcome to the Youngevity UK and Europe Show with Dr. Wallach. Each week we'll go through the Dead Doctors Don't Lie show and handpick information regarding people's specific health concerns. So listen now as Dr. Wallach gives his expert advice on how to deal with the root cause of illness and disease nutritionally. If you would like further information on the products recommended in the show, they can be found in the description below the video. Enjoy the show.
The Youngevity UK and Europe Show.
Okay, Doug, what pearls of wisdom do you have for us today?
Well, this is another one of these examples of doctors going off the rails here. I've got a story from Fox News headline, Hospital Doc Gave Near-Death Patients Excessive Pain Meds, say an intensive care doctor ordered significantly excessive and potentially fatal doses of pain medicine for at least 27 near-death patients in the past years after a family asked that life-saving measures be stopped. An Ohio hospital system announced that after being sued by a family alleging an improper dose of fentanyl actively hastened the death of one of those patients. This was all at Columbus area Mount Carmel Health System acknowledged that the doses were larger than needed to provide comfort for dying patients. It raises the question about whether there was an intentional or possibly illegal use of the drugs to accelerate deaths. The system said it had fired the doctor, reported findings to the internal investigation authorities, and has removed 20 employees from patient care pending further investigation, including nurses who administered the medication as well as pharmacists. And Mount Carmel said the situation came to light because an employee reported a safety concern. The health system shared no information on what might have prompted the employees to approve and administer excessive dosages. Regardless of the reason, the actions were taken, and we take responsibility for the fact of the process that place not sufficient to prevent actions from happening, according to President and CEO Ed Lamb. He's quoted as saying that we're doing everything to understand how this happened and what we need to ensure that it never happens again. And the attorney who brought the suit in the case says layers and safeguards repeatedly failed to flag a grossly excessive dosage of fentanyl or medical professionals intended to accelerate the death of the patient, 79-year-old Janet Kavanaugh. They say, on balance, it's hard to believe that the former occurred rather than the latter. This is not just a simple situation of an error, according to lawyer Jerry Leesburg. Lawsuit against the health system, the pharmacist, a nurse, and the doctor, of whom they identify as Dr. William Hussle. They say Hustle's case emerges amid national debate over physician-assisted suicide, sometimes referred to as physician aid dying. In such cases, physicians prescribe medications in life-ending amounts for terminally ill patients. It says 5 states, Oregon, California, Vermont, Washington, and Colorado allow the practice, and 20 other states have considered it but not passed the legislation to do so. So there you go. They're just offing them. I'm surprised they're doing that because they want to milk the insurance and get more money.
Well, I'm sure there's deeper reasons going on there. They may want to marry the widow. Who knows? I've run into cases like that where billionaires were involved and the doctor wanted to marry the widow, so they were trying to accelerate the death of the billionaire. And fortunately, we were able to step in and save the guy, and he lived 12 more years, just using nutrients. And so it's one of those things where medical doctors' primary interest is the medical doctor's interest. And so this is why we believe that people need to take control. The medical system has failed us terribly. There's so many statistics over and over and over and over. Again, a trade that kills 251,000 of their customers, a.k.a. patients, in their workplace every year from simple mistakes, kills 1 million of their customers every 4 years in their workplace from simple mistakes. How can doctors stay in business with statistics like that? That's Johns Hopkins. Those aren't my figures.
The Youngevity UK and Europe Show with Dr. Wallach.
Thanks for listening to this week's show. If you're listening on YouTube, subscribe to the channel, and for more info on the products mentioned in this week's show, check out the links in the description.